Which of the following is the most specific name of substances that are able to produce fever? And the reason we say produce fever is because when we have our temperature thermostat, which we control the temperature too hot, too cold, and adjust as necessary, there are some times where we might want to purposely, as the body, increase the temperature and cause a fever to try and kill off any potential invaders, so we can't allow them to thrive, because if the temperature is so high, it kind of kills off the infection that is lingering in. And fever is actually a normal bodily response. We just get concerned when it gets too high because that could cause other issues within the body, and that's when we might want to use antipyretics to control the fever. And just as an aside, it's acceptable to note that 100.4 degrees Fahrenheit or higher is what is known as a fever. So someone might think that they have a fever when their temperature is around, let's say, like 99, which we could say is elevated temperature. And for some individuals, if they tend to run low, maybe for them that does seem like a fever. But the universally acceptable temperature for a fever is 100.4 Fahrenheit or higher. So now, looking at the choices, let's review what all these terms mean so we could be directed toward which one is related to which would cause a fever. So option A is a zymogen, and this is actually an inactive substance which converts to an enzyme when activated by another enzyme. So enzyme to another enzyme would activate it, and it's an inactive substance converted to an enzyme. So different than something that specifically is used to increase fever, this has a different meaning. So we could eliminate option A. Option B, antigen, you may remember from previous sections. This is the foreign substance that might be what is causing the reaction of the fever. So maybe the antigen's present, because remember the antigen is like an invader. So an antigen invades, and then the body's response is the cause of fever. But the antigen is not the specific substance which produces the fever itself. Something else has that role. So we could eliminate option B. Oncogene, you may remember from previous sections that this is a mutated gene that leads to the development of cancer. So if you think oncology, oncogene related to cancer. So not the specific name of the substance that produces fever. So we can eliminate option C. Pyrogene sounds similar to another word that we had mentioned earlier. If you think of an antipyretic, this is a medication that is used to reduce fever. So if you think Tylenol, Advil, Motrin, all of these types of things, so, or you could think of the generic name, acetaminophen and ibuprofen. If you happen to look at a bottle, the next time you see one, you might note that it says antipyretic, or it could be used as a pain reliever. So you might see fever reducer, pain reducer. Antipyretic is the term that is used for reduction of fever. So reduction of fever, and the reason it's called that, if you look at the pyretic part, pyrogen, this would be the name of the substance that produces fever. So anti against, so antipyretic reduces fever, pyretic fever, pyrogen produces fever. And therefore, option D, pyrogen, would be our correct choice for which substance produces a fever in the body.